Thank you for choosing to learn more about addressing responsive behaviors in people with dementia in the hospital setting. This is Module 2 of a 5-part learning series. In this module, we will look at understanding the person through personhood and person-centered care, goals of care, behavioral and dementia histories, and the person's capabilities, and assessing behaviors by using the 4 Ps of unmet needs framework and considering whether the person might have delirium, since people with dementia are at higher risk of experiencing delirium. Our assessment of behaviors starts with understanding more about the person so that we can provide a holistic, whole person or person-centered approach to care. In healthcare, personhood means recognizing an individual beyond their medical condition, considering their identity, values, and experiences. Understanding the things that make someone unique helps us provide care that is tailored to their individual needs and respects who they are as a person. There are many intersecting factors that contribute to a person's identity, such as their sex assigned at birth, gender identity and the pronouns they use, sexual orientation, race, ethnicity, cultural background, and the language they prefer to communicate in. It also encompasses personal experiences and beliefs, such as trauma history, religious or spiritual beliefs, relationships, daily routines and preferences, life experiences, education, and hobbies. The personhood approach is at the heart of person-centered care and emphasizes treating individuals with respect, compassion, and dignity. Person-centered care in dementia is based on individualized assessment, recognizes and supports personhood and capabilities, and incorporates information about values and goals of care. Understanding a person's values, preferences, and goals of care, also known as what matters most, is essential for effective care planning. The person and their care partner are the experts in their own goals and priorities, while the care team provides the expertise to support those goals through appropriate interventions. The what matters conversation is important because it ensures care is person-centered and fosters collaboration and trust. It also helps to align care with the person's values, anticipate future needs, and reduce conflicts. The conversation about what matters most to the person as well as their care partner includes asking questions such as, who or what matters most in your daily life? What activities would you like to spend more time doing? What symptoms or responsive behaviors are the most bothersome or interfere the most with what you've just described? It is also important to create opportunities for open and sensitive communication to understand the goals for treatment. We will explore how to identify priority behaviors and set goals for them in the next module. Information about the individual's behavioral history and type of dementia helps us establish the person's baseline, anticipate potential triggers, and select appropriate interventions tailored to their needs. A variety of sources can be used to retrieve this information: the person themselves, their care partner, community care team members, and documentation from the community and in hospital. Recognizing changes in behavior requires familiarity with what is usual for the person and can help detect shifts that may signal distress or an unmet need. Understanding usual behaviors can also help with knowing what to expect and how best to respond. A behavioral history includes descriptions of the person's usual behaviors, common triggers, and patterns and the strategies or care approaches that have been effective. This information can provide a guide for handling similar situations in the future. Any recent changes in behavior are also essential to note, as they may indicate a need for reassessment of the behaviors or for delirium, or may require a new intervention. Understanding the type and stage of dementia will also help to inform the care plan. For instance, certain medications may be inappropriate for a person with dementia. For example, haloperidol should not be used for somebody with Lewy body dementia. Similarly, psychosocial interventions can vary based on the person's capabilities, which are affected by their dementia. Understanding the person's capabilities and the impact this has on their participation in their care and interaction with their environment will assist in developing care approaches that support functioning, prevent frustration, and lead to a positive care experience. This can help us with demonstrating respect for the person by doing with rather than doing for, and by not asking the person to do tasks which are too complex or that they can no longer do. It is important to consider a person's capabilities for self-care, such as bathing, toileting, mobilizing, and eating; language comprehension, which is the ability to understand language and express thoughts and complete sentences; social abilities, such as the capacity for socially appropriate behaviors and the ability to pick up on and respond to social cues; and recognition and understanding of common objects, like watches, clocks, calendars, pens, hairbrush, toothbrush, or eating utensils. After we better understand the person, we can better understand their behaviors. When responsive behaviors occur, it helps to have a systematic approach to assessment and management. You observe a responsive behavior or behaviors. What do you do now? When responsive behaviors occur, it is important to use a systematic approach to assessment and management. First, ensure the safety of all involved. Is there a risk of imminent harm to the person or those around them? Behaviors that may increase risk of harm can include attempts to leave the care setting, entering another person's room, entering restricted areas, impulsivity, the removal of medically necessary lines or tubes, and physical actions such as kicking, hitting, or biting. Next, assess the level of distress the person is experiencing. Is the person greatly distressed by what is happening or what they perceive to be happening? If risk of harm is imminent or there is significant distress, consider calling for assistance from team members, securing the environment, calling for a code white, implementing de-escalation strategies, or seeking medical support if needed. Whether the behavior is high risk or low risk, to respond effectively, it's important to use a structured approach to understand the meaning behind the behavior and identify potential triggers. Validated frameworks such as PIECES, the ABC model, and others have been widely used in various care settings to support this kind of assessment. The 4 Ps of unmet needs offer another simple, person-centered framework to guide this process. Your organization may already use a specific approach, but if not, consider adopting the 4 Ps as a helpful way to organize your understanding and response to responsive behaviors. The 4 Ps of unmet needs is a holistic and person-centered approach to assessment. It can be used by the care team to support care of the person with dementia and responsive behaviors. The 4 Ps framework considers multiple domains and the impact they might have on the person with dementia and their responsive behaviors. The first P, physical, refers to medical or biological factors that may be contributing to the behaviors. The second P, psychological, includes emotional well-being and mental health factors. The third P, personhood, includes factors related to the individual's identity, values, and life story. The fourth P, place, considers the physical and social environment surrounding the person. Let's look at some examples for each domain. When examining physical contributors, we consider factors such as pain, whether it's unrelieved, poorly managed, new, or chronic; the severity of their illness and stage of recovery; medication, which includes adverse effects, new or missed doses, changes to medication, and whether a thorough medication history has been conducted; bowel and bladder concerns, including urinary retention, frequency, urgency, incontinence, or constipation; fatigue and poor sleep; thirst and hunger; vision or hearing impairments. The possibility of delirium should also be considered. Psychological contributors often include anxiety, depression, and frustrations stemming from memory loss or challenges with communication. How care partners approach interactions can also play a significant role. Personhood contributors involves understanding the person's unique identity and how their life experience may impact their behaviors. Place or environmental contributors include factors like noise levels, whether it is too hot or cold, or lighting is too bright or dim. We also consider changes in location and spaces, such as where the bathroom is. The social environment should be considered too, including the impact of other people and their style of communication. After assessing for behavioral and dementia history to establish baseline behaviors, consider whether their current behaviors are in line with their usual behaviors or whether there has been a sudden change. Delirium always deviates from the person's usual behavioral patterns, either by timing or severity of symptoms. Delirium is a sudden change in cognitive function and may be associated with responsive behaviors. Delirium requires urgent assessment. People with dementia who are admitted to hospital are at high risk for delirium and should have delirium prevention strategies in place. If there is a sudden change in the person's pattern of behavior or mental status, always consider delirium in the differential diagnosis. When delirium is present, it's essential to investigate and address any underlying causes, as managing these can significantly improve outcomes. The Delirium Microlearning Series for Acute Care are available to help you learn more about prevention, screening, and management. In this module, we learned that all behavior has meaning, and responsive behaviors are often an expression of unmet needs. Recognizing personhood and using person-centered care ensures that individuals are treated with dignity and their care aligns with what matters most to them. Collecting behavioral and dementia history allows for the anticipation of triggers and the delivery of tailored interventions. The 4 Ps of unmet needs is a tool to help provide a systematic assessment of contributing factors. And delirium should be ruled out when there's a sudden onset of behaviors.